The elderly are currently defined as individuals over the age of 62 who have a distinct disadvantage in overall well-being compared to other members of society. Overall well-being includes social, emotional, spiritual, environmental, occupational, intellectual, and physical factors. This disadvantage is due to a lack of choices or resources available. In 1900, only 40% of our population lived beyond the age of 65. Today, 80% survive to be 65 and 50% live to be the age of 80. The 85 and older population is the fastest growing segment of our population today.
Disadvantages include chronic health conditions such as arthritis, heart disease, cancer, respiratory diseases, Alzheimer's, and osteoporosis. These diseases require treatment with medications that are not always provided by healthcare. Some of these conditions can affect intelligence. Another disadvantage would be substance abuse. Individuals can begin self-medicating for pain and emotional difficulties. Sometimes it is an established coping mechanism from youth. The last health disadvantage would be depression. Depression can be caused by changes in social and physical environment. The elderly have a more realistic view of death compared to middle adulthood. If death is impending, they can know it. And a big part of getting older can be spiritual well-being as we come to terms with death. The elderly are also faced with a variety of financial difficulties. The first being Social Security problems. Many retired couples rely on Social Security for 50% of their income in retirement. And most retired, unmarried seniors count on Social Security for at least 90% of their income in retirement. Not enough money is going into Social Security, and too much money is coming out for it to be sustained. The second wealth disadvantage would be the rising costs of healthcare. These costs include Medicare, out-of-pocket expenses for doctor's visits, increased drug prices, diagnostics, and medical devices. The third disadvantage for wealth would be forced retirement. Ageism and stereotypes exist today towards seniors, and those with inadequate retirement savings are forced to find a new job, often with lower pay and lesser status.
There are many recommendations for the elderly dealing with health and wealth disparities today. It is important to remember that these difficulties can often be caught early and prevented through education and intervention. Unfortunately, for those affected now, this will not be enough. It is also true that the earlier chronic conditions are caught, the easier they are to treat. But at any stage, treatment should be provided regardless of age or financial standing. Individuals, no matter how old they are, need to be educated on the addicting nature of substances. Communities should be provided where support groups are accessible for the elderly to talk to and connect with peers. Locations such as community centers and churches are great for education, social gatherings, and outreach for those in need of help. Education on programs such as Medicare and Social Security, detailing how they work, would make them easier for this population to use. The elderly should plan for their retirement by taking advantage of unemployment benefits, consulting with financial advisors, and consider taking on a job with less pay and status, not just for the supplemental income, but for the activity. As a society, we need to build on the progress made by the Affordable Care Act, rather than just assuming that all the problems are solved. For example, pharmaceutical prices need to become more transparent so the elderly can no longer be taken advantage of. An increase in Social Security taxes can also provide a relief to the funding shortfall. The age of retirement can also be raised. For the elderly to use Medicare, they have to be 65 years old, and the new medical definition of when the geriatric phase of life begins is age 75. Placing income requirements such as the maximum your income can be and still receive Social Security may decrease the money leaving this program.